NanoTess is a social enterprise with the mission to leave no one behind. And we do that through catalyzing healing through catalytic innovations. We have a technology that's been proven to help accelerate skin and wound healing, reduce inflammation, and provide a broad spectrum protection for antimicrobials.
I think the founding of NanoTess is quite a personal story to everyone that works here. For us, I actually lost both my parents to chronic conditions that we're trying to address. So that really inspired us to shift and change our career paths into what we're doing today. And that's why a lot of our core values are also resonating. Some of the challenges that we lived through of how expensive wound care is and how difficult it was, even though we had the full support of healthcare professionals and clinicians that were our heroes. But there was not that technology there. So for us, I think overall from a difficult situation, now that we're like a few years later, we can proudly say that being able to make it a really positive outcome and saving thousands of lives. NanoSalve is based on principles of catalytic nanomedicine, where it allows your body to facilitate all those wound healing processes. We tell clinicians to focus on the 3I principles, which allows them to, if the skin is injured, if there's inflammation, if there is infection, that's where our technology can help, or a combination thereof.
Yeah, so NanoSalve does those three things really, really well. So expediting or optimizing healing, reducing inflammation, modulating inflammation, and providing the broad spectrum antimicrobial effect, which includes everything from bacteria, yeasts, viruses, and fungi. The fact that all of those attributes are rolled into an easy to use topical gel is really what sets it apart. We're able to deliver advanced wound healing attributes at the tips of the fingers using something that universally everybody understands how to use. So that's really what sets it apart.
So I think going back to the principles and the core of our technology, of our catalytic technology, enables your body to tap into the biomimetic principles of healing. It's not about which type of wound or chronicity or acuteness, but whether the same way that we train clinicians is like, if your wound or skin condition is you have those principles of the 3Is, of like, if there's injury, there's inflammation, there's infection, then this can help. So there's many wounds, and wounds are normally classified by origin or by chronicity, but we all have to heal in the same way eventually. So that's the part that we tap into. So for us is more rather, if you think this wound is going to take you 9 months, when you integrate NanoSalve, you're reducing that amount of time, that effort, and expediting all the healing process. The majority of the people that work with us work because we created a big impact in their family. We have med school students who were able to save their grandmother from an amputation and decided to change their career into helping us make this a global impact. We have, I think it's actually really interesting to see the magnitude of a problem, where we call it the silent pandemic of wounds. And it's silent because it's a very personal problem. And we already know that every person that starts working with us, we even give them samples to take home, because there's always going to be that uncle or that aunt or my grandmother who we're not telling you they have these issues, but when they realize there's a possible solution, they're like, hey, can I try this? And in a few weeks, almost every person that starts working with us is like, hey, like, I didn't know, but my family member had a chronic wound and we're able to heal it. So that's the type of impact that we can do. And statistically, even just following the amount of people who with comorbidities, diabetics, or elderly, this problem is just growing.
Right now, our record that we've done with a healthcare provider is a wound that was open for 13 years. It's officially closed. And the feedback in that case and many other cases that are similar, where they've tried everything and nothing seems to be working, is that the technology has been seen to almost kickstart the healing effect. So in those first few weeks, they see a massive boost in the healing rates. And then from there, the second piece of feedback is just that it's really easy to use. So patients are able to actually do their own wound care in the home. It's freeing up resources within home care to really focus on the most vulnerable or at-risk populations or indications, and really utilize their expertise where it's most needed.
I think another piece to add there, a big feedback that we're getting is how a lot of clinicians are quite grateful of how the way that we design our pricing, it's maintained throughout the health system, and then actually patients can afford their treatment even if they're not in a hospital, even if they're at home or they don't have insurance. So that's really interesting when it wounds, we have a big disadvantage where you might have an amazing treatment that it's like $1,000 an application in the hospital, or like even some of the very simplistic antimicrobials, they're like inexpensive in the hospital, like $15. But when you go out into the pharmacy, now each one of them is like $50. So patients discontinue some of that follow-up because they can't afford it. And with NanoSalve, that continuity applies, and they've been able to, that's a comment that they've been quite grateful. So I think that's where we always focus our clinicians back into the 3I principle. It's not whether it's a chronic wound or if just a fresh new wound, the post-surgical wound, all those wounds have to heal the same way. Now the question is, do you want to expedite that healing? When it comes to post-surgical amputations, expediting that healing comes out to de-risking future infection, de-risking the ability of dehiscence. So it's all those really expensive things that come from not acting early, and it almost can an early onset approach to being able to expedite that healing so that all that cascading of problems gets prevented.
From the cost savings perspective, the Institute for Health Economics took a look at the study data that was done by Alberta Health Services, the University of Calgary's research team, and the Can Health Network. And they actually looked at the direct costs of the standard of care alone, and then NanoSalve within the standard of care. The benefit that they found was at the patient level, the system or site level, and the health authority level. Our technology, when integrated into standard of care, helped reduce wound care costs by approximately 46%, which is a massive number when looking at the hundreds of millions of dollars spent on wound care every year. So it equated to about 100 million in cost savings for just Alberta alone, with the potential of having this product integrated into every wound care procedure.
I think another interesting fact that we can recognize is that in average, we tend to heal 50% faster than when you integrate that technology. So we have two concepts, which is there's the cost savings, the direct cost savings, and then it's all the cost prevention. So there's like not just the savings, but everything down the road, how when you integrate this technology, now you can redirect the time of your nurses into more the more complex type of cases, or you can you allow the system to give more capacity in that place. So I think overall it's been quite successful in that area. So from the design, I think is one of our core principles of how we look at our technology, and I think it's really ingrained in our company of like doing good is good business, and doing good is not just focused on our patients, but doing good towards our planet. NanoTess products are made with recyclable materials, and they also have, due to our nanotechnology capacity, you can compress a lot of treatments into a very easy multi-use format that like saves a lot of waste. One of the things that shocked me the most was the amount of waste in a wound dressing. It was just one wound dressing for like a pressure injury, and you would fill a bucket of garbage. And that gets done almost daily by thousands of people. It's just a massive impact to the environment. So if even with our large format, the one that a large format box would this is equivalent to 60 4x4 patches. So if you think about it, this, and then you have a pile of garbage that came from 60 patches and the patches themselves. Now you compress it into a recyclable box and a multi-use format. So it makes a significant impact in the environment and the waste.
I think from a Canadian healthcare perspective, the biggest challenge that we face in scaling across Canada is just independent decision making at each site or each health authority level. So Canada it's our home. We want to be able to provide this technology to our family, our friends, and fellow Canadians. But when you go to every single site and every single site wants to run their own evaluation, it becomes a very high burden for a company to scale. That in and of itself is being worked on and trying to be addressed by several organizations and across Canada, and really being led by the Can Health Network. And how do we pull all the stakeholders in the room together, show them the evidence done by a trusted peer, and be able to make decisions from that evidence of a peer. I think we're in our infancy, but we're heading in the right direction, and hopefully we'll be able to really spread and scale this to achieve our mission to leave no one behind when it comes to advanced wound care.
I think in Canada it's important to recognize that we're not used to innovating, and that comes with a lot of bad habits when it comes to adoption. And we're always waiting for our brother in the south to do things first, and then they're like, okay, now I feel good to do it. So but how do we change that mindset, and how do we become first? So we do need to do things differently. We need to trust each other. We need to show that a solution that works in Quebec is a solution that can work in Alberta. And how do we as a country move forward and support each other? I believe like healthcare adoption moves at the speed of trust. So how do we focus on that? The adoption in Canada has been quite impressive so far, and we're currently one of the biggest things that's keeping us busy. We're moving into quite larger facility for our manufacturing in Calgary. We're proud to say that we decided to keep our manufacturing in Canada and like build it locally. So we're moving to a 10 times bigger facility to be able to enable that demand and our international expansion.
We've always built NanoTess within those principles that Canada is our starting point, and then the world is what we want to ensure that our technology is capable of suiting its needs. A large part of the world has underdeveloped resources and capacity. So building a technology in a manner that really does leave no one behind, in the sense that it's easy to use, it's cost effective, and it drives strong clinical outcomes, was core. Because when we look to bringing this technology to around the world, including to countries like Mexico or South America, the healthcare system and the constraints that exist are just different. And we wanted to make sure that from a design perspective, we have the right tool that can be maximized and potentiated in a variety of healthcare settings in a variety of different countries and for different needs. So soon to come, hopefully NanoTess will be expanding globally in the next year and being able to reach more and more patients.
Yeah, overall, our goal is to leave no one behind. And for me, I'm originally from Mexico, so it's quite personal for me to be able to support the amount of people who need it there and that don't have access to care. I believe this technology can change the world, and in the right hands, like with all the heroes that we work with, the nurses, the physicians, it can enable them to do things that we haven't been able to do before.